Hi everyone, welcome back to my channel. So in this particular video, I will be answering questions, relevant questions, significant questions given in my channel. And these questions, it's all about the process of hormone replacement therapy. These questions, they are related to hormone replacement therapy, and this will be considered the second part since I already uploaded the first part. Now, before proceeding on answering these questions, if you're new to my channel, please do not forget to click the subscribe button and also to click the notification bell for you to be notified and updated in my new and upcoming uploads. Okay, so hi everyone, welcome in my channel. As I've mentioned in my introduction in this particular video, I will be answering questions related to hormone replacement therapy. Now, I will not be tired of reminding this to all my viewers who wanted to undergo hormone replacement therapy and those who are currently undergoing hormone replacement therapy. HRT is a risky, dangerous, and life-threatening process. And in HRT, to self-medicate is not advisable. If you have the potential, or if you have the ability, or if you have the capability to consult to a doctor, an endocrinologist to be specific, then the best thing that you need to do is to consult to them for you to be guided on what are the things that you need to do and what are the things or concepts, ideas that you need to learn in order to make sure that the process you're in is safety and you're considering your health aspect as a transgender. Now, these ideas I will be sharing to you guys. These answers I will be giving based on these questions. They are based on my own experiences. Aside from that, they're also based on the knowledge that I gained upon questioning or upon asking questions from my transgender friends who are successful. Transgender friends of mine who are successful in hormone replacement therapy. Again and again, disclaimer, I am not a doctor. I am not an endocrinologist. I'm also not a person working in the field of medicine. Okay, so first question. Hi, I would just like to ask, what is the best or what medicine will you suggest to be taken along with micropill in order to avoid complications of kidney and liver? Something that is budget friendly, or medicine that is budget friendly. First and foremost, I would like to clarify that in hormone replacement therapy, I am not a fan of using birth control pills. I will not advocate or I will not support the use of birth control pills in HRT because birth control pills are dangerous and they can increases the risk of blood clottings in your body. So I suggest the best thing that you need to do is to use those medicines that are specifically designed in the process of hormone replacement therapy, such as medicines like Progainova or estrogen. But to answer your question, I think the best thing that you need to do is to partner micropill or birth control pill with a testosterone blocker, because micropill, it contains estrogen, and in HRT, aside from taking estrogen, you also need to take testosterone blocker in order to achieve, or in order for you to achieve what you wanted to achieve in HRT, and that is for you to develop secondary female characteristics and to minimize further masculinization. Okay, so moving on to the next question. Ilang days ba interval ng pag-inject ng fennel or phenolkinin F injection? So before, when I was transitioning, I used an injectable hormone, specifically phenolkinin F injection. In my case, I injected my hormones before once a week, but then I just found out that it is not good because that particular medicine, estradiol benzoate, will only last 3 to 4 days in our body. That is why you need to inject phenolkinin you need to use or to inject phenolkinin every 3 days or every other 3 days. Like for example, if you injected that on Monday, so it is a little bit expected that the next session will be on Monday, Tuesday, Wednesday, Thursday. So there should be 3 or 4 days interval in order for the medicine to be effective, or in order for you to experience the maximum effect of the medicine, if you get my point. Next question. Hi sis, what is the best hormone combos? So in HRT, in order for you to, there is no such thing called best combo, perfect combo. For as long as you just follow the right medicines that you need to take, then you will become successful in HRT. I keep on reminding my transgender viewers that in hormone replacement therapy, you need to use 2 medicines. First, estrogen. The purpose of estrogen is for you to achieve secondary female characteristics. And second is testosterone blocker. The purpose of T blockers for you to minimize, or for you to reduce further masculinization. Those 2 medicines, they are prerequisite. They are very essential in HRT. If you're only taking estrogen, it's useless because your body will convert that into male hormone, especially if you haven't undergone orchiectomy or removal of testicles, because testicles, they are mainly responsible for the production of male hormone, the testosterone. Now, if you're only taking testosterone blocker, it's also useless. It is also not good because T blockers can have or can cause side effects towards your bone development or your bone density, and that is based on the endocrinologist I consulted. I gained that idea from him. Next question, is it painful? She is referring to the video where I injected estrogen hormone, specifically phenolketonuria F injection. And first things first, in HRT, to self-inject is really not advisable, but I'm doing that before because I'm a confident, independent woman, and that is why I'm doing it, because the main reason for that is because I want to learn to inject on my own in order not to cause any frustrations among others, in order not to disturb others. I just want to do it on my own. And to be honest, it's really painful if you will be self-injecting, because you will feel the needle going inside or going in to your muscles. And there are also instances wherein there are too much blood coming out, and it really freaks me out. There is one particular session when I injected phenolketonuria F injection, and the blood coming out from the injection site, it's just way too much. I'm nervous and I was panicking inside. So that moment taught me a very important lesson, that to self-inject is really dangerous. Okay, next. What do you mean feeling of dryness? Tigang ganun. So he's referring to the effects of using undercur as a testosterone blocker. So when I was taking testosterone blocker, undercur, one of the effects that I've got to experience is the feeling of dryness. Even though I already taken a bath, I feel like my body is just way too hot, too dry, and I blame undercur for that. Tigang na tigang talaga, literal. So dry, and the feeling that you wanted to take a bath every now and then, because the dryness is just so overwhelming and it's very difficult to handle. Next question about the use of phenolketonuria F injection. Is it normal that the injection site will... Is it normal that the phenolketonuria F injection will cause swelling in the injection site and something that is painful? The answer is yes, because phenolketonuria F injection, it's an oil-based product, and it will really cause swelling, most especially in the injection site. And in order to alleviate the symptoms of swelling, what you need to do is to have a hot compress. Okay, so next question. Is it okay to only use phenolketonuria? Is it okay to only use phenolketonuria F injection? My answer is it's definitely not okay. You need to take testosterone blocker because phenoquinone F injection, it's only an estrogen hormone or medicine, specifically an injectable one. In HRT, you also need to take testosterone blocker because T blockers are important in HRT. Next, what estrogen did you take while taking HILES? Before, when I used HILES as T blocker for my HRT, I also used Progainova as the estrofem. HILES for a T blocker or testosterone blocker, and Progainova estradiol valerate estrogen for my estrogen. And I must say, I don't like that particular combos. It's useless for me. Okay, so next question. Hi sis, I would just like to ask if it's legit or safe to buy estrofem and Adocure in Shopee or Lazada. There are selling platforms, online selling platforms here in my country, Shopee and Lazada. Yes, it is okay for as long as you have, for as long as you have to make sure that that particular seller is legit, and you need to look for the reviews or feedbacks given by those buyers of the particular seller in order for you to gain idea if they are legit sellers or scammers. But I'm not really into buying hormones before in Shopee or Lazada. I really wanted to communicate to the direct seller of hormonal products in order to make sure that I can prevent or that I can avoid unwanted events or things like scams or frauds. Because in hormone replacement therapy, you need to spend too much money for your hormone combos, and you need to make sure that you're buying the safe and legit product for you to become safe in HRT. We are down to our last two questions. Are you still undergoing hormone replacement therapy as of today? The answer is no, definitely not. Because I just found out that I have a congenital heart defect, and my doctor, an endocrinologist and a cardiologist advised me to stop, since it will be very dangerous and risky for me to continue undergoing HRT since I have a heart defect, and taking estrogen can cause or can trigger my heart condition. That is why I stopped. And I have to clarify those viewers that keep on commenting that I'm being hypocrite. They believe that I'm still undergoing HRT. The answer is I already stopped because I consider health as a very important aspect. I want to live long enough. I want to fulfill my goals and dreams in life. Okay, so next question. This will be our last question. In undergoing hormone replacement therapy, is it okay to only use estrogen like estrofem without anti-androgen? Again and again, in HRT, it will be useless if you're only taking estrogen. Testosterone blocker is very important. It is prerequisite in HRT. These two medicines, estrogen and testosterone blockers, are very essential in HRT. And removal of one of these medicines will have an adverse effect to the process that you're in. Therefore, it is not advisable that you're only taking estrogen because it's useless. If you're only taking estrogen and you're not taking testosterone blocker, it will be useless in a sense that your body will try to convert estrogen into male hormone, and that will be the main reason for you to have a hard time achieving the ultimate purpose of HRT, which is feminization. Especially to those persons who haven't undergone orchiectomy or removal of testicles, you badly need to take anti-androgen in order for you to develop secondary female characteristics and to reduce further masculinization or to minimize, reduce further development of male characteristics. I think that would be all, guys. I really hope that you learned something out of this video. If you learned something out of this video, please do not forget to click the like button and subscribe button as your way of showing support to my channel. Thank you so much once again. God bless us all. See you on my next video. Happy transitioning. Have a happy and safe transition, transistors.